back to the Health Chat. I'm Dr. Greg Eckel.
I'm Dr. Greg Nye.
We've got a rather light topic today.
Yeah.
Rather light. We're going to talk about cancer. We've been doing quite a bit of cancer care here at Nature Cures Clinic, in particular under the tutelage and guidance of Dr. Greg Nye, who has actually become, I feel, one of the most educated folks in North America, if not the world, on cancer. So maybe, I don't think he would ever say that about himself, but I'll say it for him just because I sit back in the clinic conference and hearing him talk about this and different conferences that he goes to, I think that it's true.
Well, thank you.
Yeah. So, first off, here's an easy question that 30 seconds or less. What is cancer?
Oh, yeah.
Yeah.
Quick answer.
Easy one.
What is cancer? Well, so kind of a textbook definition of it would be the uncontrolled growth of cells, right? And then there are all kinds of nuances that we can get into about what defines that process. Why is it happening? Of course, that's the question everyone really wants to know. Why is this process going on? Why are these cells growing uncontrollably? And so, what is cancer? I think there are two very different ways of thinking about it that I don't believe personally are mutually exclusive. One is to think of cancer as this very destructive process that's going on in the body, this absolutely uncontrolled growth of cells that end up
stopped at any
have
point.
to stop it.
Yeah.
The other way of thinking about cancer, I think, is recognizing that a cancer cell is a very, very sophisticated cell. It's not simply a broken cell that's, it's lost some functions and now has become cancerous. It actually has acquired some very sophisticated abilities that allow it to do what it's doing. And so if we think about it in that context, there is an element of cancer that seems to me, and not just me, in the research that I read, that there is a purpose behind what it's doing. Cancer is trying to accomplish something. Now that doesn't mean that what it's in the process of doing that it's helping us.
Right.
In fact, there are many processes that our bodies go through that are intended to accomplish something that can ultimately be detrimental to us, like shock.
Right.
The body is trying to accomplish something with shock, but actually you can die of shock.
Sure.
Right?
Yeah.
And so what I think that allows, if we have that other thought about cancer, it allows us a much wider range of approaches therapeutically. That if we recognize that this is not a random process that happened, this is a directed process, and if we then have in our mind what is the goal here in this particular person, what is the goal, then it opens up greater possibilities for treatment.
Sure, got it. Now, some of the stats on cancer are just staggering. I mean, we were going through that the other day, and at the start of the day, again, another uplifting topic of 1 in 2 men in their lifetime are going to have some type of cancer.
Diagnosed, yeah.
And 1 in 3 or 4 women?
Got to keep my numbers right here. I believe it's 1 in 4 women.
And that's diagnosed with cancer in their lifetime. So this is definitely a timely topic. Any idea as to why it seems like that's an increase of cancer?
Well,
just tracking better?
Yeah, lots of thoughts about why.
Sure.
I think in many ways we have created a world that feeds us all of the factors that promote that process in the body. So if we think about cancer as a way of, let's don't go in that direction.
Okay.
So there are various influences that impact the body in such a way that it feeds into the pathway that then cancer moves along. So what are those factors? Well, anything that increases free radical damage, meaning kind of factors that stress our bodies at the level of a cell, factors that stress our bodies, factors that deplete oxygen from our cells, anything that does that is going to promote the changes in the cell that then move toward cancer. So what does that? Well, inflammation does that.
Right.
We now have institutionalized a diet
Right.
that promotes inflammation in our bodies. All kinds of environmental pollutants, whether it's in our air, it's on our food, all of those exposures at the level of a cell promote free radical damage, promote the depletion of oxygen. And so it is true. It's not simply that we're better at diagnosing cancer, and so we're seeing a lot more of it. More people are getting cancer.
Yeah.
And I don't think there's a great mystery behind that. It's not because we have some new genetic glitches that they didn't have
before.
5 generations ago.
Yeah.
Our genes have not changed that fast. It's that we have created a world
The
in what we
environment.
eat, in the space we're living in the stresses that we're under in our jobs and our relationships and our sleep deprivations and all of those things. Every one of those is a pathway that ultimately leads to a tendency towards cells to move down the cancer path.
Got it.
Yeah.
So another question that comes up a lot of times I hear from folks is, well, how much experience with X, Y, or Z type of cancer do you have? And it just seems to me as a naturopathic approach that that's not a correct question. I mean, we're, in the allopathic or Western medical model, you're going to an oncologist who specializes in cancer.
Right. Yes.
And how much of that knowledge base is necessary in particular treatments for cancer?
Yeah, good question. So I think, in the conventional world, you divide every cancer up into types and even subtypes.
Right.
And subtypes. And then people specialize in those subtypes. What I think is true is that cancers, while manifesting in diverse tissues of the body and having elements that are unique in each of those tissues, what is more interesting to me are the things that they all have in common. And so, to pick sort of arbitrarily some kind of percentage, I think that all cancers share maybe 80% of the characteristics of cancer cells. And then there's the 20% that define it by the tissue type, by the type of cancer. And so, for that reason, unlike elements in the conventional world, I think that many of therapies that are very helpful in the treatment of cancer are really focused on that 80%, and in that way are common across cancer types.
Got it.
And then there's the knowledge that is needed around what's the 20% that makes prostate cancer unique, or that makes breast cancer unique, or some of the blood-based cancers unique.
Sure.
You have to be savvy with those things, but there's a commonality among cancers that opens them up to therapeutics that span a wide range of cancers.
Got it.
Yeah.
Okay, great. How about testing? A lot of times people will come in and their biggest worry or concern is, I've got cancer. There's something going on with my body. I don't know what it is. I've got cancer, right? That's the fear.
Yeah, sure. So that's another big question.
Sure.
So
2 words or less.
Yeah, can't do that.
Sorry.
There are lots of testing options. And what I would say is that so there are those tests that are recognized in the conventional world as ways of monitoring treatment for various types of cancer. Alpha-fetoprotein is a way of monitoring liver cancer treatment, or CA15-3 is a way of monitoring breast cancer treatment. CA125 for ovarian, there are these various
markers.
kind of classic markers that get monitored to see, is this therapy working or not.
Right.
They're not used so much for diagnosis because they're not felt to be specific enough to define. They're not. In other words, if you get a positive on one of those in somebody that you don't know has cancer,
Right.
you can't just say, "Oh, you have cancer."
Sure.
but so they're used to monitor people that are already known to have cancer. So that is one set of tests that are pretty specific to cancer types. You know, certain tests get used for colon cancer, and others get used. I mean, there's some commonality. Then if we get outside of the recognized kind of the FDA-approved testing for these cancers, there's a whole other set of tests that can be used to both diagnose and to monitor cancer, to diagnose the presence and to monitor the treatment. And those, of course, fall in under experimental testing, and some of those tests can be done through conventional labs like Quest and LabCorp and the very conventional labs, and when you get the report back, it says this test is not approved and it's experimental. But there's a whole other set of tests that are even prior to getting introduced into the conventional labs, where these specialty companies have, there are studies done on these tests and consistent results, but not enough has accumulated, and the FDA hasn't gone through the process of evaluating and saying, okay, we put our stamp on this.
Got it.
And so there are lots of tests available, and many of those too can be cancer specific, and mostly because, for instance, there's a well, I won't even go into specific examples because there are so many examples there. But there are testing options available that allow us to look at a lot of things.
Excellent. Well, so we've picked a huge topic, and usually we're trying to keep these within a small viewing time. I guess I would like to continue our dialogue on this because I think there's some really unique and interesting things on your approach to cancer care. Anything that you want to part with today for our viewers out there and listeners around the rather broad topic of cancer?
Part with today. I guess for people that are looking for information about how to use natural therapies in their cancer care, there is a very broad spectrum of options. It can be much more sophisticated than simply taking the right vitamins or the right herbs that it's like doing an internet search and finding this is anti-cancer, and so you take that.
Right.
That a plan is comprehensive and it's focused in along a particular therapeutic pathway.
Got it.
That's maybe the short way of saying it.
Sure. Great.
Yeah.
All right. Well, thanks for watching and listening out there. If you've got any questions, you can email them to questions@naturecuresclinic.com. Definitely check out our website. It's very interactive, or very active. I don't know about interactive unless you start posting comments. And away we go.